Yeah, so we have diabetes ed, we have the boot camp, we have pulmonary rehab and cardiac rehab and wound care, and then we also have community programs. So what I'm going to talk about today is just some of those programs that we have. Primarily, I'm going to talk about the Thrives Coalition, which is sort of a new group that's a combination of Theta Care and the ADRC, the Senior Center, Bethany. It's just a group of people that work in all those agencies that came together to provide resources to put on some workshops. So you may or may not have heard of these. We've been doing them for about 2 years. There's 4 workshops that we offer, and all of them are free, but they're not thing. It's like a 6-week class that you can take. And they had better outcomes from their disease. So, for instance, if you take the Healthy Living with Diabetes class, your blood sugars will improve based on you managing things differently and setting your own goals. When you take the Stepping On class, which is a falls prevention class, the statistics on that is 50% less falls. So the programs are really effective. They're taught by trained facilitators, and they're done in a group setting, so they're also pretty much fun. I mean, you meet people. The people that are in the classes usually bond pretty well together. And they cover a broad variety of topics. So I was just going to go through the 4 different classes that are offered, because we're going to start up again in February. So what we're doing is we're offering these classes. Each class is offered once in the fall and once in the spring. And they're all done right over at Theta Care, because we have a really nice facility that's easy to get into, good parking, with a little kitchen. So we offer them at the hospital, basically, because that's how we are contributing to the Thrives Coalition, by offering that space for free. Okay, so the first one is called, the one that's coming up first is called Healthy Living with Diabetes. It's a research program led by a peer facilitator, and so our peer facilitator is actually somebody, her name is Deb Aber. Does anybody know Deb? She actually was one of our patients in our diabetes program. She did really well. She made a lot of changes. She really understood what it took to make those changes. And so, like, when she was in our boot camp, she would sort of contribute in a way that I could have probably walked out of the room and said, you just take over here. So then she was so excited to make the changes, and also the fact that she enjoyed working with her peers in that group, that she volunteered to become a facilitator. So she had to go through some intensive training. I think it was 2 full weekends, which the Thrives Coalition paid for. And now she is the facilitator for this class. So what this class is about is you get a workbook, you learn different skills for managing diabetes. Basically, people know that they have to eat different and exercise, but this gets it down to the level where you're helping each other as people with diabetes. And by the time the class is over, people end up kind of staying together. They still go out to coffee. They share recipes. They support each other. And this class meets for 6 consecutive weeks. Each workshop length is about 2 hours. So it's, this one's going to be from 1 to 3:30 in the afternoon. And it starts on February 23rd and goes through March 29th. So that's the Healthy Living with Diabetes class. The second one is called Living Well with Chronic Conditions. A little different than the diabetes class. The diabetes class focuses strictly on diabetes. Chronic conditions includes a lot of other conditions, and I don't know if anyone here has a chronic condition, but just some examples might be arthritis, chronic headaches, COPD. Anybody have COPD or CHF, something like that? High blood pressure, heart disease, chronic pain.
Those that are home that don't want to go.
Pardon?
Just somebody at home that would want to go.
Oh, you got one of those too?
Yeah, actually that's a good point. A lot of times it's people that, you know, when you have a chronic condition, especially if it's like a pain or a breathing thing, you stop doing things in your life. You stay home, you just kind of pretty much start living within that one room. Especially people with COPD, they don't get out anymore. They're embarrassed by their oxygen tank. They can't breathe getting from the car to the door. And so that's actually what this class is about. It's about how to get your life back. And again, it's a Stanford program, so it's been proven through research that people have improvement after they take this class. And that's what I like about these classes is we could say, you know what, this isn't just some workshop we made up. It's something that they actually did medical research on for many years and got it honed down to these are the things that really work for most people, and most people see improvement. So this class actually starts in April and goes through May, and it's in the morning, and it meets for 6 weeks. So that's the Living Well with Chronic Conditions. Actually, the guy who's at the state level, the Wisconsin Institute for Healthy Aging, he is the person that works with the agency that gives us the license to do these classes. He got involved because he has a chronic condition. He has post-polio syndrome. So that's something that we're starting to see more of, people who had polio when they were kids, and then they got over it, but then I guess it comes back.
Really?
As an adult.
Really?
And when I first met him, he had to leave his job as a car salesman because of his post-polio syndrome, and he walks with 2 crutches, and he has about a year left before he's in a wheelchair, he said, because it's a progressive thing. But he was very, very down with that post-polio syndrome, and he took that class, and he said it pretty much turned his whole life around, and now his whole job is to promote the classes because of that. So that's kind of testament as to why we're doing these classes.
Oh, yeah, we need people to do that.
Yeah, apparently they work. And it's not that you're getting like a professional nurse in the class, it's somebody who's got a chronic condition, who's been trained to lead the class, and I think that's why it works.
We did powerful tools.
For caregivers?
And we also did the stepping on.
Okay.
So we just kind of stopped doing it here because you guys were doing it, we weren't getting the response there.
Yeah, that's interesting. The history of the Thrives group is that some of the classes were being done here, I think at the senior center, is that right? Mm-hmm. And then Bethany got a grant to do community stuff, so then they started doing the classes, and they wanted to do them at the hospital, and we could see that, my God, how's anyone gonna know where these classes are? There's no coordination. So then we formed this group to mostly not overlap with each other.
Yeah.
Because if 2 people are doing the class, then neither class is gonna be full.
No.
And it's the same instructor. So we sort of reset it, and we started doing some of them here in the beginning, but once they saw the mosh room and how easy it was to park and get to the classroom and that we set up everything for them, then they're like, let's just do them at the hospital. So it wasn't something that was really meant to take it away from the senior center. It was meant to make it so that we could have a schedule so that everybody would know when the classes were. But if you've taken both of those classes...
I still have all my binders and stuff from that, too.
So I was going to talk about the stepping on next. Do you have something you want to say about that class?
No, I'm sorry, I didn't mean to interrupt.
No, that's okay.
Just letting you know I am listening.
Yeah, but what did you think about stepping on?
I thought it was, I think it's an awesome program. It just, I don't know, it's just hard to get enough people to justify holding it here.
Right.
But I think it's an excellent program. I think the thing that, and I shouldn't go into this because this is not what your subject matter is about,
okay.
But I think the most interesting thing was when I was trained and certified in the program, our trainers took half the day or part of the day, and we were trainees in this program. Another part of the day, say the morning, was split into 2 segments.
Okay.
The second segment was we were residents of the Sunshine Retirement Community, plus seeing the PowerPoint what not to do.
Oh, okay.
Really was an eye-opener.
Okay.
I mean, I think everybody, whether they're afraid of falling or not, should be paying attention to that because, like I said, it was a real eye-opener. My husband and I are notorious for finally jump on the steps.
Oh, okay. Yeah, it's little things that they make you aware of that lead to falls. And, I want to just say the whole reason I got involved in this whole thing to begin with was because we were looking at the statistics from our emergency department. Because remember, I work at the hospital, right? So putting my nurse hat on, the nurses from the emergency department I can't remember the exact number, but the percentage of people that came to the ER as a result of a fall, it was mind-blowing. And most of those falls were things that, like I tripped on something on the step, or I didn't stand long enough because my blood pressure medicine made me dizzy. And some of those falls led to people's deaths.
Mm-hmm.
So we all know that, like, if you fall and you hit your head, you might have a bleed, or you break your hip, you might die from pneumonia after hip surgery.
Mm-hmm.
So it's not a very small thing. Falls can be the end of the story
Oh,
for
yeah.
many people. And I want to say there's something like 800 serious fall related things in the ER per year. It was something crazy like that.
In Waupaca?
In Waupaca. Yeah. So they started saying, what can we do about this? You know, you're in community education, what can we do? And that's kind of at the same time that that guy from the state had contacted me about these classes. And so we started saying, well, we would get involved if we could offer the stepping on class. So just to speak to your point, it was hard to get the classes filled
Mm-hmm.
because it takes a lot of marketing to get the word out,
Yeah, and
doesn't
we
it?
did, I mean, we did.
But it's like it's never enough, and that's actually why I'm here today. You have to continually be out there talking to people. It doesn't just take a flyer, it takes talking to people.
Oh, yeah.
Right? And I think,
They called me up and said that it was filled up with, I was told in February, no,
last fall,
yeah. And it
So-
was, they said it was filled up, so they, and I thought, well, are they putting my name on the list? I wish I never thought to ask.
well, I'm gonna put your name down today, because I know that there was somebody that was on a waiting list, and that name got lost, so it was you.
Oh, you probably would.
And that's the good news
There you
is,
go,
when you
Karen.
guys were doing it just down here with the resources you had, you couldn't
got
fill the
another one.
class. Now, when we offer stepping on, we usually fill it now. So that's all good news. So I'm gonna have you just put your name on this sheet, and then we'll, if you wanna sign up for it, I mean, I'm not trying to push you into it, but, so stepping on is a great class. It's our #1 class right now. We're training some more facilitators, this summer. And that one's gonna start in April, and it's also gonna run through May, and it's from 9 to 11 in the morning. So when I'm done talking, if you guys are interested in signing up for any of these classes, I'll just have you fill out this sheet, and we'll sign you up for them, okay? Then the last one, which you know about this one too, Powerful Tools, right? Powerful Tools is a little bit different. What that's about is, it's giving the caregivers tools that they can use to take care of themselves, basically. And so that one is a really hard class to talk people into. Why do you
Yeah.
think that is? You're caring for, is anyone here caring for somebody at home?
Yeah,
Okay,
somewhat.
okay. Whatever degree it is.
I just come down here and it takes care of it.
So what we find with people that are taking care of somebody, when it gets to the point where it becomes a crisis, then they don't have time to take this class. So what we're trying to get people to do is take the class before it gets to that point.
Mm-hmm.
So does anybody know anyone, or have you been in a situation where you're taking care of someone, you literally, it's like 24 hours a day?
Oh, yeah,
Basically.
24/7.
Yeah, yeah, and that's not the time that you're gonna have time to take this class, I can tell you. And that's the problem with this class, is it's hard to fill it because people
Nobody's
don't,
ready.
Yeah, I know.
they're not ready to
Nobody's
admit that
ready.
they need it until they're in the middle of the mess.
Right now, we're just getting.
So this one is gonna be offered also in April, and it's in the evening, because that was the feedback we kept getting, is we can't do it during the day. But now that we're doing it in the evening, they say we can't do it in the evening. And I think, you know what I mean? It's like, if you're caring for someone 24/7, the only way you're gonna take that class is if we go to your house, right? So what we need to do is try to get people to take it. If you know that in a year from now, you're gonna need this class, you should take it now, is what the point of this
Well,
is.
Now it's
I-
days or nights now?
It's nights, it's 5:30.
I think
Yeah.
the biggest thing, my opinion, and it's only my opinion, whether you're caring for someone now or not, you need to know this stuff.
Right.
Because I mean, like me, I'm cocky, I'll admit it, because of what I do here and, you know, all these other things that I've been trained and certified in. But 2 years from now, if I have to be my husband's caregiver, I'm not gonna, obviously, like you're saying, you're not
Yeah,
gonna take
it's
the
too
time.
late, then you
It's too
can't
late.
come days
It's-
or nights.
Yeah, I mean,
Right.
it's better to do it while
Right,
you.
and if it was just one night, but it's not, it's 6
7.
weeks
Yeah,
to get the benefit out of this class. So I guess when you're talking to people, if you know someone who's in that kind of pre-situation, You might wanna try to talk them into taking it.
Yeah,
But that's the problem with this class nationwide. It's hard to get people to take it because of that psychological element of
Yeah,
it.
I don't need it yet.
I
I'm
don't
not
need it
ready,
yet.
or they're
Yeah.
not into
Or
that.
that's not gonna happen to me, I'm not gonna be that person, and
well,
then bam, you are. So,
I
So-
was,
it's frustrating that one because it's such a great class. So that's, I guess my message is, talk to people that you know about this, see what they think, and
What do they cover in that class?
they cover a lot. It's really, I'm just gonna read it. Powerful Tools for Caregivers. It's an educational program designed to help family caregivers take care of themselves while caring for a relative or friend. You'll find benefit if you're helping a parent, a spouse, or a friend. They learn to reduce stress, improve their self-confidence, better communication of feelings, increase your ability to make tough decisions, and help locate resources. Don't know about. Again, until you're in the middle of it, right? Okay, so, it's a class about learning how to kind of take care of stuff on your own versus waiting until you're in the hospital and the discharge planner is rattling all these numbers off at you. It's knowing those resources, so that's right there a reason to take that class. So, like I said, I can help people sign up today, and that's partially why I came, because that's how we're gonna fill these classes. But now that you've heard this, if you could each take one of these and maybe talk to a friend, or talk to a neighbor about these classes. If you can think of anyone that would fit in any of those 4 classes, just promote that, knowing that it's gonna make their life better. It's worth the investment of the once a week for 6 weeks to take these classes. So any questions about the Thrives classes? Remember, they're all free.
So what are you gonna tell us at that last class? We never can make it day or night. What is
oh,
the?
powerful tools.
What's the
What are you
answer?
covering? Just, list each week, like what is it?
It
One word or?
basically I'm sorry.
No, you tell, 'cause you know.
It basically teaches you how to ask when you're, like you with your husband,
Uh-huh.
if you have to be his caregiver, it basically teaches you how to ask others for help so that you can get a break, even if you just wanna go off in another room and sit and read or knit or whatever for an hour and not even leave the house. It teaches you to get someone to come and help out without feeling guilty about taking time for yourself.
Right. I think that's almost the key point of the class. And it's easy to talk about it at the table that you shouldn't feel guilty, but when you're in that situation,
Oh, yeah.
it's almost a catch-22. And so the class actually is a pretty heavy class. I mean, they go into some heavy stuff about
Oh,
emotions.
that's the one with the Downmaker video.
Yes.
Yeah, I cried like a baby when I saw
Yeah.
that one.
And I think that's kind of what it takes to break through that pride thing that we have, that we can do it all, is to get down and dirty with the emotions. And that might be partially why people are afraid to take it, because we don't really want to let our guard down,
No,
right?
no.
Did you ever do the diabetes one? You have a friend who's still working.
We haven't, but if we get that feedback, we can.
I'll take it, and she may be able to, take off work for it.
Okay.
But she's pretty overwhelmed.
They can
With her diabetes?
Yeah, she doesn't understand the points or, any of that stuff, and she's just struggling to feed herself.
Oh my gosh. The class is really very good. It's 6 weeks in a row, but if she can't make the class, and I'm not trying to drum up business, believe me, but maybe she needs an individual appointment just to kind of find out what her issues are. In our diabetes education, that's what we do. We are certified diabetes educators, and it's paid for by Medicare, so maybe, okay, it's paid by insurance too. But the thing is we can make appointments that are more flexible for people's time.
Is that a nutritionist?
Can I take the
Like your state
information?
person?
Sure. Yeah, we have a dietitian and we have a nursing staff. We're all certified diabetes educators. And we do a lot of medical management. We help people learn to adjust their insulin. We basically find out what people's issues are and try to help them solve them, is what we do. So I can get you that
Yeah,
information.
but even that, because her works, she does telemarketing, and, telemarketing type
Okay.
work, so she might be able to work,
Yeah.
you know,
When you have,
flexible. So I take the information.
you take
for
the
that, too,
information
in
for
case
both.
she can-
Okay. The thing about diabetes is, once you have it forever, and your needs change over time. So this doesn't take the place of diabetes education. Diabetes education doesn't take the place of this. There's many ways to get support when you have diabetes, and I really think over a lifetime, you probably end up doing all of it, based on where you're at with your diabetes. Okay, any other questions about the Thrives classes? Anybody?
Are they all free?
They're all free, which is not the case in all counties, by the way.
And do you have it in like the buyer's guide? Because a lot of people otherwise don't see some flyer, like where do you pick up the flyer? Where do you see it?
Well, we're trying to get them out in the community,
And we
and
actually have some here, and there's a poster out there, but I think it's hard for people to see, you know, like.
Where do you
Yep,
pick it
there's
up?
one by the door.
Or at the library, everybody, picks up something at the library, maybe they'll see it there. Maybe, they have posters on the
yeah,
wall.
they let us put a poster at the library, they won't let us put the flyers on.
Oh, I see.
I think because if they did, then everybody,
Yeah.
you know what I mean?
Yeah, on
That's
the
the way it
wall.
is. Yeah, but we're hoping that through posters, but also through word of mouth, people recommending it. And then, I'll leave a big stack of these here today, and you guys, if you have a place like at your church that you can set these, that's another good way to get the word out. We're trying to get some of the churches to join our coalition so that we can get that word out better. But these are just for you guys to take and pass out to friends, or just put places where you know people will grab them. Okay, so I'm just gonna also talk about a few other things. We have a pre-diabetes class that's coming up. We offer this 3 times a year. This you have to pay for, though. Insurance does not pay for people to learn about pre-diabetes, unfortunately, which,
So they're gonna wait till you actually have that?
yes, and
Sounds
then
like
they pay.
Medicare.
Yeah, well, Medicare
The way they
sets that
do
rule.
things.
Yeah.
So when you're right in the middle of it, some crises,
I
you gotta
know.
learn it too.
It's like write your congressman, but it's terrible. But anyway, so we offer this class. This one we have to charge, but we decided we would charge the lowest possible fee, which is, it works out to $10 a session, which is the same amount of money it costs to go to Weight Watchers. Okay, so we figure if people are willing to pay Weight Watchers, they'd be willing to pay for this. This class is phenomenal. It teaches you about diabetes and how to prevent it, and it's also an exercise class. So you come and you exercise, and then you go to a little class, and then you get some homework every week, and it's 9 weeks. And if you complete the class, you get a free 1-month membership to the Health and Fitness Headquarters.
Oh, we don't wanna hear that.
Oh, I know, because it's sort of your competition.
Sort of, yeah.
Sort of. But it's the thing that kind of can attract people, like, okay, once people get in a routine of exercising, then they're more likely to try the other avenues. I will say that in this class, we have, one of the classes talks about exercising. We do hand out the senior center exercise brochures at the
I didn't.
No, I know, but you know
That's part of
what?
my job description.
We try to get people to come here. Oh my gosh, we push it. And last week, actually, I put out some cards that described what cardio was versus strength training that you guys made. Those little save the date cards you made.
Oh, yeah,
Yeah, because we try to get our cardiac rehab people to join the senior center.
yeah.
Okay, so here's another thing. Our diabetes education program, we also have, we used to call it a support group, but now we're calling it our adventure group because we're going to be going on little field trips this year. The first one is actually coming up February 2nd, and again, this is free. This one, you have to meet at Piggly Wiggly, and our dietitian is going to do a grocery store tour. So
I've
this,
seen that.
yeah, and boy, that is the most awesome way to learn about how to read labels. So I made some little flyers specific for that. The seating is limited on this. You can't have a mob. So if you want to go to this, you got to sign up ASAP because there's, I think, a few slots left in here. But I'm going to leave these here. We want it to be a full group. We always schedule it for an hour, but it usually takes about 2 hours because people have so many questions. Okay? And then the next one, they're going to meet at Dr. Evert's office and talk about eye health. Then in June, we're gonna do a cooking class. We have a new little cooking kitchen, teaching kitchen that we set up over by our building, which is really cool. So, we're actually gonna make a meal together. In August, we're gonna have a meeting with Joy Kabisky, who's one of the nurse practitioners, and she's gonna just talk about what are the key things to make the most out of your doctor appointments. That's an issue, isn't it?
My nurse is good.
Yeah. I mean, when you go to the doctor, they have like 5 minutes, so how can you get the most out of that, okay? And then in October, we're meeting at Christensen's Apple Orchard. Ooh. And then the big one that I'm excited about in December, eating out while maintaining your health, we're gonna meet at the Woods Restaurant and learn how to order healthy things off that menu. So that's gonna be a challenge, right?
At the Woods, yeah.
Yeah. And that's where everybody likes to go. So we figured, how can we make this work? So that one will be fun. You know, we aren't gonna pay for your meal though, it's Dutch treat.
Oh, we can handle that.
Darn the luck.
So if this handout can get handed out, that would be awesome. And these are all free, but we want you to call and register so that we know how many people to expect. Okay, because some of, like the grocery store tour, we cannot have 50 people at that. We have to cut that off, okay? So I'll leave this here for you guys to hand out.
Is there limit seating in that last one?
Limited seating on the Woods Restaurant?
No.
The ones, well, they're all somewhat limited. I think they're all 30 people, except for the grocery store tour, I think it's 15. So you really have to call and register to get to go to any of these things.
You say about 30?
I think the rest of them are 30. The Apple Orchard, the Woods Restaurant. Yeah. I think these are gonna turn out to be really fun. And they're interactive, and they're the things that we all do in our real life versus sitting in there and listening to someone lecture us. It's getting out and figuring out how we can manage our diabetes in the real world, so.
Is that gonna be a local grocery store?
It's at Piggly Wiggly. Piggly Wiggly. You know, that's a really great store, that guy. He is really interested in the
Scott,
community.
yeah, he is.
And I'm not saying Pick and Save isn't, but he wants us to do stuff like this there. He wants us to come and block up the aisles and talk about nutrition, and he's an interesting
When
guy.
is that one?
When? February 2nd.
Coming soon.
Yep. And
Tuesday.
this sheet shows how to register. You just call our central scheduling. So I'm gonna leave these out here. You guys can call and register. So that's my tale of woe. Any questions?